My name is Dr. Saibal Kar. I'm one of the directors of structural heart disease at Las Robles Hospital. I also am one of the physician directors of interventional cardiology for the HCA Healthcare. Traditionally, cardiac disease has always been equivalent to blockages in the coronary arteries. So people always think about heart disease as blockages in the arteries and having a heart attack. Structural heart disease is actually disease of the various elements of the heart other than the coronary arteries, such as the valves, the muscle, the septum. And so any of these disorders are called structural heart disease. Structural heart disease intervention has actually become one of the most important parts of clinical research in cardiovascular disease. Several techniques, especially minimally invasive, are being designed to address structural heart disease problems. For example, fixing a valve. The traditional way of fixing a valve was open heart surgery, and now we have various methods to either repair or replace the valve without open heart surgery. Mitral regurgitation is one of the commonest heart valve problems in the Western world. The mitral valve is one of the important valves on the left side of the heart, and it's in between the left atrium and the left ventricle, and it prevents blood from going from the left ventricle to the left atrium to the lungs, and therefore it's a very important valve in the body. Mitral regurgitation means leaking or incompetence of the valve. This disease is quite prevalent. In fact, most of the people with mitral disease for a long time remain asymptomatic, and when it becomes severe, they can become symptomatic. And if it's not treated in time, they develop heart failure, they develop arrhythmias, and they finally succumb to the medical problem. The standard of care for treatment of mitral regurgitation is surgical repair or replacement of the valve. And repair is preferable to replacement if possible. However, surgery has its problems, because when a patient undergoes an open heart surgery, the recovery often can be prolonged. There's a definite operative mortality, bleeding, etc., etc., as a result of which there are several patients, because of their comorbid conditions, who cannot undergo a mitral valve repair or replacement. This is a true unmet need, especially in elderly patients. MitraClip is one such transcatheter approach for treating a leaking valve. And this procedure, as I told you, is done through the groin with a slender catheter that's advanced to the heart under ultrasound and X-ray guidance, and then a clip is deployed on the leaking valve. The procedure is extremely safe. It's done on a beating heart without cutting the chest, and the clip itself is repositionable and removable if it doesn't work. So MitraClip has actually been an amazing invention, and it has rapidly been adopted in the United States, and now is being adopted all around the world. I've actually had the privilege of proctoring several physicians all around the world doing this procedure, and I received several letters from several physicians and patients thanking us for this procedure, which they could not have had other than this procedure. I just got a letter from a physician from India, a surgeon, who suffered from this disease for years and was not a great surgical candidate. She underwent this repair with the MitraClip in Chennai, and I actually remotely proctored this case through Zoom. And she sent me several letters of thanks, which I received from her as well as her parents. So this is just an example of showing you how this is spread around. There are approximately 150,000 cases done worldwide, and it continues to rise. There are new clinical trials being done to investigate the role of MitraClip in moderate surgical risk patients. And we think if these clinical trials are positive, it'll expand the population of patients who can be treated by this very novel device.